Hey TikTok Universe, did you know that medical boards and health insurance companies can look at your charts without your knowledge or permission? When I was in practice, several insurance companies would come in my office once a year and audit about 25 charts. So they sent a person in who I'm assuming had no medical training to make sure I was following the narrative so that they could pay me or make sure I was doing what they wanted. Otherwise they would ding me. And the last straw for me with the medical board was when I was helping patients off of benzos that wanted to be off of them. I was using low-dose phenobarbital as an anxiolytic to replace the benzo as they weaned off. And the medical board didn't like that. So an investigator, also no medical training, showed up and subpoenaed 29 of my charts. I had to give them paper copies or electronic copies of these patients' entire charts so that they could put them on file and have a bunch of people with no medical training, like lawyers. The executive director had an MBA, and sniff through charts to see if they liked or didn't like what I was doing. Well, you can imagine some of the information that was in charts on patients that I was treating for opiate dependence or trying to get off benzos. So it was frustrating, made me mad, and I left medicine over it. I couldn't take it anymore. It was the straw that broke the camel's back. So medical boards are supposed to protect the public. In 2 states, they've proven that the actions of medical boards actually harm the public, North Carolina and Massachusetts. And there's kind of a strong push in Massachusetts to get rid of the medical board. And they actually made the executive director of the Massachusetts Medical Board resign over these types of actions. So if you don't like that, tell me in the comments, make a phone call, send an email. Tell your insurance company to quit, sniffing around through your charts, and definitely tell the medical boards you don't have my permission to look at my medical records. So, what's going on, folks? Have a great day. I'll talk to you soon. Bye.